Hello, the objectives of this presentation, no? So to continue with, as healthcare providers, we need to be aware and understand kung ano-ano ba mga trans health issues, no? But just to let you know, the topic for this lunchtime would only be on communication, basic information and communication skills. For all of us, familiar tayo sa mga patients or cases gaya ni Benny, no? Na 18-year-old self-identified woman. Nung kabataan pa siya, gusto niya na magsimula ng hormones. Nung bata pa siya, gusto niya maglaro ng manika, no? And always the company of girls. Si Benny kasi very reliable yan sa household chores, visibly sa cooking, laundry, and marketing. Nung 16 years old na siya, may neighbor siya, si Stephanie, and idol ni Benny ito at gusto niya maging gaya ni Stephanie. Ngayon, si Benny ay nagko-contemplate na magsimula na ng hormones. So that may enhance sa kanyang feminine features. Anong dapat gawin natin? Hindi naman, familiar rin tayo sa ganitong kaso na si Lina, no, 22-year-old, na isang Japanese entertainer, no? Sa Japan, no? So she started on using pills, no? Diane 35. And basically, paano yung nakuha yung paggamit ng pills para ma-enhance sa kanyang beauty is through his friends, no, na trans din. So sa simula, she started one pill, then she increases to 4 to 6 pills kasi gusto niya magmadali, no, sa paggamit o ma-enhance sa kanyang feminine features. However, at that time, may nararamdaman siya like nipple tenderness, nagsusuka-suwa, nagduduwal, nabubuang yung brain fog, parang ano tawag dito sa Tagalog, parang bangi, no? And then she noticed na nagki-crave siya ng maraming pagkain. Then eventually nag-gain siya ng weight. No consult was done. 6 months later, kaibigan niya nag-recommend na i-take yung aldactone, another medication, and ang isang injectable. However, wala siyang funds para magsimula sa another pill. So what she decided is to increase the number of pills intake, no? At sa pag-increase ng pill intake niya, ang nangyari, may nararamdaman siyang flank pains, may nararamdaman siyang mga kasamaan sa katawan. So, case 3 is about Seth, no? Si Seth naman, 25 years old, identified as a man. At the teenager, no, lives like a man, sports short hair, wearing long pants, shorts, and familiar of playing war games. So, along with the boys. And at a young age, no, gumagamit siya ng breast binders. At home, very familiar siya to do carpentry work, electrical work, and plumbing. So, at a young age, marami na siyang crush na babae, no? And she started courting girls. Seth is serious now to improve her physical features as a man. Now, she is referred by a friend to seek medical consult. What will you do? So ito yung mga typical case nakikita natin sa ating komunidad. And sometimes some of us as healthcare providers, we don't know how to help or support these patients, no? Or these clients of ours. So kanina, na-present ni Miss Naomi all about SOGIE. So this is a very beautiful illustration of the gingerbread about sexual orientation, gender identity, and gender expression. Just to review, pag identity, no, ito yung paano ang tingin mo sa sarili. Pag sinabi nating sexual orientation, saan tayo nagiging attracted to, no? O saan tayo may pagkakahumiling. Pag gender expression, ito yung pamamaraan kung paano natin na-express ating sarili through our identity. At pag sinabi natin sex, ito yung anatomical part ng ating katawan. Paul, question. Tama pa ba yung slides na nagpa-flash dyan?
Yes, Doc. Go ahead.
Oo. So, hingi tayo na sagot sa mga audience, no? Ang gender affirmation process sa Pilipinas para ma-affirm ng iyong sariling gender identity includes the following. A. Change in the use of clothes, hairstyles, nicknames. B. Use of medication that enhances one chosen gender. C. change official name according to chosen gender, and D, A and B only, E, all of the above. So, Rad, can you help me kasi naalala ko dati, may poll, may sasagot ang mga tao, no?
Well, Doc, hindi tayo nakagawa ng poll ngayon. So probably
okay.
they can have a chat, but we can just go on with the discussion.
Okay, so I give you 10 seconds to think anong sa tingin yung sagot. So ulitin yung tanong, pag may gender affirmation process sa Pilipinas to ha, para ma-confirm ang identity niya, ano ang involvement. Okay? Sana may sagot na kayo. Ang sagot dyan ay letter D. No? A and D only. Kasi sa Pilipinas, hindi pa kasama ang official change ng ating pangalan. No? So, na-mention kanina madalas yung word na gender or transition. So, pag sinabi natin gender affirmation or transition, ito ay process ng bawat individual para ma-affirm ang kanyang identity. No? Maraming categories yan, social, medical, at legal. Pag social, sinasabi natin pag-puting sa pagtawag sa atin. No? Pag medical, ito yung gumagamit na ng hormones at ito rin yung nag-undertake ng sex reassignment surgery. At pag legal naman, ito ay ang pagbabago ng pangalan at ganun din ang kanyang chosen sex, no? At napapalitan na maaari ang kanyang sex at birth. Take note, sa transitioning process, hindi kinakailangan lahat, no, na mangyari ito. Walang such thing as completion. Lahat ay mag-undertake nito, no? Ang ilan happy na sa social transitioning, ang ilan hanggang medical transitioning, no? But iba't iba ang mga take ng ating mga trans clients dito. Next question. Ito. The following statements regarding trans health are true, except, ano ang false dito sa statement na to? Una, safe hormone management is not readily available in HIV treatment hubs in the Philippines. Letter B, physical examination of trans person is not different from male and females. Letter C, trans health shall be anchored in human rights framework. Letter D, health providers' biases serve as barriers for trans people to access health services. Or letter E, no exemptions. Ano ang mga statements dito ang totoo? Ano ang false, bale? Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So, ang sagot dyan, lahat yan ay true. Letter E, no exemption. So, kung titingnan natin ang senaryo ng trans health sa Asia-Pacific region, kasama ang Pilipinas dyan, walang public health system ang maaaring makapagbigay ng gender-affirming services, no? At ganun din yung safe hormone management. Kung ikaw ay mag-a-access niyan, kinakailangan out of pocket, ibig sabihin niyan, out of your money, private service, doon ka pupunta para ma-access yan. Often than not, ang mga healthcare providers natin ngayon are insensitive or limited ang kakayahan para mag-provide ng trans health services. More glaring ay ang negative attitudes ng healthcare providers. Ito yung kadalasan kung bakit hindi pumupunta sila, no, sa kanilang mga doktor. Often than not, they feel distressed, no? Pag sila ay mag-undertake ng physical examination, no? So, keep in mind na just like other human beings, trans people also have the same health rights, no? Maganda yung pinoint out ni Naomi na it's basically human rights. It's a human rights thing. So it should be included in all services, just like any other human being. And as a to adapt sa human right framework, no, it should be universal. It should be provide equity, accountability, transparency, and participation. So, ang Pilipinas ay signatory sa iba't ibang mga iba't ibang mga treaties, no? Kung saan ang health ay isa sa karapatan. Sa Pilipinas, no, napapaloob ang health as a right dito sa ating mga ilang batas, no? Since we are on HIV/AIDS, napapaloob yan sa RH law, sa Medium Term Plan 6 ng DOH, sa HIV/AIDS, at ganun din sa AIDS law, RA 11166. So, nagkaroon kasi ng consultation meeting sa mga trans health advocate and pinag-isipan ko ano ba ang konsepto ng health, no? What is a comprehensive package of trans health? Kasi bago itong konsepto sa ating lahat. At ito ang kinalabasan ng konsultasyon sa providers at ganoon din mga advocates. At nakikita nyo na sa human rights na papaloob ang pangangailangang pangkasulugan ng mga trans people. Ang proseso ay pinag-isipan at pinag-usapan at ang ginamit na approach ay try to see to it ang pangangailangan ng isang trans person mula nung pinanganak siya hanggang maging elderly siya. Kaya life cycle approach ang ginamit. At ang mga iba't ibang kataghay, no, at iba't ibang mga categories na tinignan, kung ano ba mga pangailangan ng trans, ito ba biological, psychological, social, cultural, economic, medical, or political, legal, no? Keep in mind na sa bawat yugto ng buhay ng isang trans person ay iba't ibang mga pangangailangan na kailangan niya nalalaan according to health. And sa pag-undertake ng consultation na to at sa proseso na to, nilapat ng mga members noon, no, ng mga participants, ano ba ang way paano ma-address ang health needs. So just to show you na ang Pilipinas, proud tayo rito na ang Pilipinas ang nakapag-develop nitong framework na to, no? Sinaliksik ko rin sa ibang mga dokumento, literature sa iba't ibang mga klase, no, sa developed countries, wala pang nakapagbibigay ng framework. So, proud tayo na Pilipinas meron ito. So, kaya nasabi ko, napaka-importante ang komunikasyon. Importante na maisipin natin na unique ang health needs. Hindi natin pwedeng ma-lump ang mga trans people sa MSN. And as healthcare providers, no, very crucial na ma-ensure natin na mag-access sila ng mga serbisyo. And the common reason kung bakit hindi sila pumupunta at nagkakaroon ng delay, insensitive tayo, disrespectful, at punong-puno tayo ng judgment sa ating language pa lamang. So, just a simple tip, no? Ito lang ang mga short tips na kailangan maisip natin when we are to relate and talk with trans people. First is, kailangan tanungin natin how would they like to be called, no? Kung sinabi nilang Miss Naomi, and then we use the term Miss Naomi all throughout our conversation. O kung sinabi niyan Darna, then we use Darna all throughout. So, at all times, we use neutral language, no? So that hindi siya offensive. Open-ended questions are very important and very helpful para makapag-probe tayo further. Priming questions does help. Ano ba ang priming question? For example, Ms. Naomi, may I ask a very sensitive question? Okay lang ba? So this will help me a lot in further understanding you. So that's a style of priming question so that you'll be able to dig deeper and probe deeper kung ano concern ng ating client. Accept what terms they are using. So we all familiar that there are a lot of jargons, no? MSM, trans people would use jargons, minobrocha, charing, charot. So if we don't know, we ask and clarify. Very important yun. Do not interpret or do not assume na alam natin ang ibig sabihin nun. That's dangerous, no? It's okay that we don't know. So we just humbly ask na, what do you mean when you say binoborocha? So that we have the same level of understanding and so that, kasi alam mo, nag-evolve siya. nag-evolve ang jargons ng MSM tsaka transgender. So it's important that we clarify. And if we feel that we offend trans people, it's no harm saying I am sorry. So please do accept my sorry. Now, what are the particular questions that would help us further improve our probing, no? So these sa slide na naka-show ngayon, ito yung mga effective questions na kailangan ma-erase natin, no? And will help us further understand, no, ang trans health needs, no? Questions such as how is your puberty or adolescent like? How would you describe your gender identity? Or to whom are you attracted to at the moment? Have you taken steps to change your outward appearances? So these are the possible questions that will help our trans client be comfortable and be able to open up, no? And for us as healthcare providers, we're able to dig deeper and really help, no, our clients in terms of providing whatever their health needs. So importante natin direct, focus question at rate when we ask our trans clients. So some questions that will help us like looking into identity, no? Ano ba talaga identity? You can directly ask, do you consider yourself to be a gay, lesbian, bisexual, straight, queer, or something else? We can translate that in Tagalog for that matter. Kung expression naman or behavior, do you have sex with men, with women, or both? Again, that's not assumed, but because we are in front of person who is feminine or female looks, doesn't mean that she is only having sex with only male. She could have both, no? And of course, very important, attraction. Again, what we have learned from our consultation is that gender is very fluid. Whatever the preference of our client this day may change over time. So that is the reality. Okay, on to our next question, no? So what are the two scientific documents referred to for health classification or disease classification? A, Diagnostic Statistical Manual, DSM-5 of Mental Disorders, APS. B, ICD or International Classification of Diseases, 10 by WHO. C, World Professional Association of Transhealth, WPATH. Letter D, A and B only. And letter E, all of the above. So choose your answer. I'll give you 10 seconds. Okay. Kung ang sagot nyo ay A and B, very good. So yan ang dalawang documents, no? Ang DSM-5 at saka ICD-10. Ito ang dalawang documents that classify or further classify health into categories or into numerical numbers, no? The last one, the WPATH, you would know that later. So, through the years, alam nyo naman, sa medical field, originally, it's been 4 decades, no? Na ang transsexualism or trans issue is considered as a sexual disorder, a sexual deviation. 1960s and 1970s yan. Over time, nag-evolve, no? Over time, nagkaroon ng changes. And so many terms were used, no? Gender dysphoria, gender identity disorder. But what is important that in 2018, WHO has already announced that gender identity disorder is no longer considered as a mental illness and will move into sexual health chapter. Okay? So just to recall you, pag sinabi nating gender dysphoria, no? Ito yung, this is according to DSM-5. It is a marked incongruence between the the gender identity and the chosen gender, at least two of which categories are existing in the past 6 months. So at least dalawa rito, strong desire to get rid of one's primary or secondary characteristics, desire to prevent the development of anticipated secondary characteristic, or having the desire to be treated of the opposite gender. And often that not, there is always distress or impairment in social occupational functioning of the person. So you see, trans health is considered before as a mental disorder, but time has changed right now that it is no longer considered as a mental disorder. And thanks to WPATH, no, this is the World Professional Association for Transgender Health, who gave their statement in May 2010, no, urging the psychopathologization of gender nonconformity worldwide. And to quote, expression of gender characteristics, including identities that are not stereotypically associated with one's assigned sex at birth, is a common and culturally diverse human phenomenon. Should not be judged as inherently pathological or negative. So for the past years, no, WPATH has been pushing that trans health or gender identity is not a gender, it's not a mental health disorder. And just that in June 2019, there's the victory na naalis nga, na declassify na ang transgender as a mental disorder. Yan ang landmark. Now, going back to our history taking, we are doctors and healthcare providers. Is there any difference in history taking between a trans person and other regular human beings? No, the same. But we need to be very particular of health disparities. Pag sinabi nating health disparities, ito yung mga conditions that put the trans person at risk, health risk, no? History of smoking, drinking, drugs, and engaging in sexual activities. These are important things that we need to look into when we undertake history taking. It is important to us to ask questions related to support system, if she has any support system. Is there any history of harassment or violence? And this was pointed out by Ms. Naomi a while ago, no? Na most of the trans people are facing harassment or violence, no? And using the right communication and the right questions to ask to our trans people, then we know that we more or less we could establish a good rapport, no? Bear in mind, use neutral language, and let's not assume. If we don't know, we have to ask. Because they are sharing a very important thing about themselves. It is important that we need to stress on confidentiality. And for that matter, we'll know that our trans client will be able to share the much needed information. Very important, no, very challenging is for have them submitted themselves for a physical examination, no? Again, very simple. If you have started with a good rapport, no, use the right language, ask the right question effectively, then often than not, they would submit themselves for a physical examination, no? But please be in mind na we may be looking to a person who's woman physically, but later on we will be find that her body is still a work in progress. Nakuha niyo ako? So a male body, a male looking person, but a work in progress na female anatomy na pala ang nakikita natin sa examination. So do not be shocked. It is important that we affirm that it's okay, no? Their body is undergoing transitioning. And these are stark realities that when we are studying our med days, no, at our nursing days at that time, hindi naman tinuro na may physical examination for trans, no? But because times have changed, we need to understand that these are happening. Keep in mind that when we do our physical examination, we have to update our anatomical inventory. So from time to time, pag nagpapatingin yan, nagbabago yan. Now, important, no? Just to highlight important things in physical examination and doing history for trans people, for trans women, no? Because the prostate is not yet removed, especially for those who undertaken SRS, no? Sex reassignment surgery. It's important that we have to do cancer screening for prostate. At kung may testis pa, no? So if there's a strong family history, testicular cancer screening should be done. Now, for trans men, vaginal examination should always be done, lalo na kung sila ay nag-undertake ng, kung family na is strong for cancers, no? And for both, if they're sexually active, so it's important that we offer regular HIV screening. Keep in mind to have informed consent. Now, these are the three major references that are available when we deal with trans health issue: WPATH, Center for Excellence for Transgender Health of CSF, and Endocrine Society. So hopefully in future we'll be able to discuss lengthily on these matters. So just what Rad said a while ago, there is this Trans Health Initiative in four countries: Philippines, Malaysia, Indonesia, and Timor-Leste, were the ones who were able to have their healthcare providers trained on how to handle trans health issues. So this is the module in 2017 that was developed, and part of which are how to do medical examination, what to ask when you are confronted by a trans woman or a trans man, and what sort of things that you need to look into when you do your physical examination. Since they are taking hormones, it is important that we also understand what hormone test or what laboratory test we are to take on and monitor while our clients are into hormones. And of course, it is important there are a lot of supplementation that we need to take on and other diagnostic tests that needs to be incorporated to ensure the absolute good health for our trans people. Since we are into trans health services, it is important that there are other needs, aesthetic and cosmetic needs that our trans people may be needing. So it is important for us to know who to refer to, like for cosmetic or plastic surgery. And in the long run, if they are decided to have an SRS or gender sex reassignment surgery, then we know somebody who could do that. Of course, very important that they may be the surgeons, the plastic surgeons would be needing a psychiatric evaluation prior to doing this surgical procedure. Other non-health, non-medical needs, support groups are very important. Legal support as well and social welfare services should also keep in mind. So as you see, it's a multidisciplinary team, no? Hindi isa lang ang doktor na mag-handle nito. There's a whole lot of team involved in providing care and absolute good quality trans health services. In the Philippines, we have Victoria and Lily Clinic who started their trans health services. For the private sector, we have the Gender Diversity Center at Makati Medical Center. And I heard that St. Luke's is coming up with their trans health clinic soon. And in Bangkok, this is one of the good practice that we have identified. Tangerine Clinic was provided trans health services in this arena. So in the Philippines, we're now starting to gather healthcare providers, advocates to form, just like WPATH, no, PPATH, Philippine version of WPATH, which are professional groups that are really for advocating trans health services.